And we're talking about your feet today on Ask the Expert. Dr. Corey Russell's here to take your questions. You can reach him by dialing this number, 419-534-3863. Your feet and ankles are our topic today on Ask the Expert. Dr. Corey Russell joins us now with some answers to your questions. Good morning, Dr. Russell.
Good morning.
All right, the first question is, it's Melanoma Awareness Month, and can you get skin cancer on your feet?
Yeah, absolutely. That is something you can see. In my career, which has spanned about 15 years, I've treated probably about 5 or 6 cases of malignant melanoma on the feet. So things to check out for, obviously it's something you need to look for melanoma in every part of your body, but in my case specifically the feet. You look for the ABCDs of melanoma, which is pretty common to for any skin doctor to let you know. A regards asymmetry. Asymmetry is basically you look at the size of the lesion that's on your feet, usually a pigmented spot that's brown or black in coloration. If it's asymmetrical, if it looks uneven in its size, that's one indication. B is for border. Basically, is it well-defined or kind of an irregular, diffuse border, and that's more of a problem. C is color, so you look at the color of the lesion. If it's uniform in color, it's less of a concern. If it's multicolored, like blue and black or brown and black in different areas, that's more of a concern. And D is diameter, if it's larger than the size of the head of a pencil eraser. So those are the 4 things. You may have one or all of those things, and if any concerns over that type of lesion, certainly see your podiatrist. That can be biopsied and checked to rule that out.
Sure. So you might have to sit crisscross applesauce, get your feet up, get a closer look, or have somebody else maybe look at it.
Absolutely, yeah.
All right. Another question. How can you tell the difference between good and bad shoe wear?
Well, this time of year, you have a lot of people wearing flip-flops and sandals and that kind of thing, and that certainly can lead to various different issues like heel pain or tendinitis. So things you look for in shoes, you look for something that's supportive. You look for something that is a flexible forefoot, so underneath the ball of your foot, the shoe is flexible. It's rigid in the middle of the foot where you have your arch. A lot of shoes you can just turn over and bend them in half. That's no good because your foot can't do that, so you want something that's rigid in the middle and has a rigid heel counter, which is on the inside of the heel. Obviously very supportive, and it's something you want to stay in most of the time. Flip-flops, sandals, yeah, you can wear that stuff probably in short durations of time because that can lead to foot problems, and if you're having any issues like heel pain or tendinitis, I'd probably stay away from the flip-flops and the non-supportive shoes.
Gotcha. And my daughter tends to do more flopping than flipping when she's wearing them, so yeah, you can just take it from that. We have another question here, and I've heard before that feet sweat about a cup of sweat a day. Is that true? Can anything be done to treat foot sweat?
Some people do have a problem with perspiration on their feet. It's a condition called hyperhidrosis. So there is actually treatment for that type of condition. We prescribe a medication called Drysol in the office. It's actually like a roll-on. You put it on at nighttime, usually every night, until the condition's under control. Then you can switch to maybe every other night or every third night or even once a week once it's fully controlled. So yes, that's a condition that can be treated.
Excellent. We have time for one quick question here. Somebody said they have a problem with dry, scaly skin on their feet, and even soaking them doesn't help. What should they do?
They're probably creating some of their own problem, unfortunately. A lot of patients come in and say, I soak my feet and they're really dry, and I try to soak them to get them more lubricated, but it doesn't really work. Well, soaking actually dries them out more. So what you need to do instead of soaking is just use a moisturizing cream on your feet once or twice a day to get the condition under control.
All right, Dr. Corey Russell, thank you very much. Appreciate it.
Thank you.
Have a good one. All right, and then next week, in 2 weeks,